Okay, another piece of the safe sleep education that I think is really important is to show people how to do a crib demonstration. So when you're training folks, show them how to set the crib up and how to create a safe sleep environment. A lot of times we can tell them, but it's when we show them that it really sort of etches in their mind. So I'm going to show you how to set up a portable crib and make it a safe sleep environment. This is a portable crib from Cribs for Kids. These are a fairly new design. But they are safety approved, so I always let parents know that you can buy a full-size crib, but you can also use a portable crib like this one. They are about $40 to $50. They are approved for child care providers as well as parents. And when you're setting it up, what you need to remember is that there are joints in each of the sides. And there's two, and so they both have to click up before you can put the base of the crib down. So you press that down in the center once all of the braces are up and sturdy. If you're looking at childcare and you have a baby that's over 2 months of age or can flip over, this is the way you want to use the portable crib. But for the new family that has less than a 2-month-old or is not doing child care, they can use the bassinet feature, and that is this mechanism. And basically it just goes in and clicks over each of the sides. You want to make sure they're taut so there's no gaps along the sides. And these should snap on fairly easily. So make sure there's no extra material that's a hazard. They have 2 braces in the bottom that will then hold the mattress in place. There's also Velcro under each side to make sure the mattress stays where it needs to be. The other thing I really like about these portable cribs, in addition to the fact that they're, $40 to $50, makes it much more economical for people. It also has the ABCs of safe sleep. That's another reminder to the caregiver to always put the baby alone on the back in a clutter-free crib. It also has mesh on 2 of the sides, which just allows more airflow, and then has instructions and warnings on either end. It's also made out of a material that you can clean with like a disinfectant wipe or such like that, where you don't need to have a crib sheet in here. If you're talking to child care providers, they by regulation have to have a crib have to have a crib sheet, and so we make sure that they are buying a crib sheet that fits the actual portable crib and not one for another size bed. But for a parent or a guardian, they can utilize this without putting a sheet in there. So if you want to know and show what a safe sleep environment looks like, you put the baby on its back in this portable crib with nothing else in the crib, except possibly a pacifier. So we encourage people to consider using a pacifier at nap time and nighttime. This will reduce the rate of SIDS. If they don't want the pacifier, we encourage people not to fasten it in any way to their clothing. And if they don't like it, that's fine. You'll also notice that this baby is using a wearable blanket so that we don't have to have loose bedding or any loose blankets in the bed. And right now she's swaddled with her arms out. So when the baby gets old enough that they can flip over or they look like they're going to flip over, we want to make sure that they're swaddled with their arms out so that it's not too tight and so that they can get back onto their back if they want to by using their arms and exercising their shoulders. If you have a baby that is under 2 months, not able to flip over, likes to be swaddled, isn't too warm, you can go ahead and swaddle the arms in. And it would look like this. But the recommendation is that when the baby looks like it can start flipping over, and sometimes that's 4 weeks, sometimes that's 6 or 8 weeks, make sure you take their arms out. So that is a safe sleep environment. Some of the other things that I want you to talk to parents about and caregivers is things not to use. So often people like to put hats on the baby, and these are really helpful when it's 30 degrees outside and you're going from the car to the grocery store or back into the house. But once they're in the house, we want to take the hat off, because one of the things we don't always think about is the head is where we regulate our temperature. And so if you've covered their head and they get too warm in the house, they've lost one of their safety mechanisms. So hats are great, but but they're really more for outside and not for sleeping. We also know that one of the things that makes the bedding or the sleep environment unsafe is portable or diapers and wipes. And these are just something that collects in the corner. So we're going to highly suggest that when you change the baby, even if you change them in the bassinet or the crib area, that you take them and put them somewhere else while the baby is in there so it can be alone on the back in a crib. A couple of the other things that we don't always think about, and I've had a number of parents say, this just feels like it's a little bit too firm. It's actually perfect for an infant. We want to encourage them not to use any pillows or not to try to make it any more cushy than it already is. What people don't always think about is that the pillow becomes a hazard because the baby may roll off and then they start rebreathing their carbon dioxide here or might suffocate. Or they lay in the middle of the pillow and this is very porous, and so they can't lift their head out of it, they can't tilt their heads because they just don't have the neck strength and the shoulder strength that they have when they get older. So pillows are great for adults and extremely dangerous and hazardous for babies, especially in a crib area. Another big culprit that we struggle with is the blanket. We already talked about the wearable blanket. These seem to creep home from hospitals, and they certainly do use them in a lot of hospitals across the country. They're great, again, to use blankets when you're going inside and outside from the car to the grocery store or to your own home. But really when they're sleeping and when you're swaddling them, the babies kick out of these pretty quickly. And then the concern and the hazard is that it might get up around their mouth area or just anywhere around them so that they start rebreathing their carbon dioxide, and then that becomes a hazard to the baby. So leave the loose blankets out of the bed and choose either to dress the baby warmly enough or to utilize some kind of a wearable blanket. So back to what safe sleep looks like. It's just the baby on her back in a wearable blanket, pacifier if she likes it, but again, we're not attaching it in any way. You'll also notice that, especially with these portable cribs, there's no need to have bumpers. Bumpers are lethal to babies, whether they're in a portable crib or a full-size crib. So now we know that a full-size crib, the slats are close enough together that you don't need to have a bumper. So all bumpers, positioners, wedges need to be outside of the bed. They are only hazardous. And a lot of times people are thinking, this is on the market. It must be good for my baby because I can buy it. And that's not actually true. So anything that people are thinking about buying, I encourage them to go to Consumer Product Safety Commission or cpsc.gov and check out the different things. But some of the things that go under the baby to supposedly hold them in place actually end up being more hazardous than good. It usually holds them in place when the baby can't move anyway. And so then when the baby does start to move around, it becomes an air hazard where they start rebreathing their carbon dioxide again. So the only thing a baby needs to sleep safely is a safety-approved crib, portable or full size. They need to be placed on their back alone with nothing else in the crib except the pacifier. So again, you can get cribs in a number of places. You can buy them online. You can buy them in discount stores. A lot of hospitals have giveaway programs now, health departments. I really encourage you to call your local resources. We're trying to get portable cribs across the state of Kansas so that people can have easier access to them. But they're obviously, available in many places online and in stores across the state and the country. Again, I would just refer people back to Consumer Product Safety Commission because they will recall everything and stay up to date on that. So that's the best place to check out the specifications of your crib.